Doctors, is AI coming for your job? AI is changing the face of healthcare daily. Some say it may one day replace doctors entirely. What's the truth about AI in healthcare? Can we one day expect automated care to replace human physicians entirely? Keep watching to find out, and leave your thoughts below. One of the most widely talked about forms of AI is large language models, or LLMs, like chatgpt. They can act as powerful decision support tools, providing valuable analysis and guidance to healthcare professionals in their clinical decision-making process, including some insights the doctors themselves may have missed. Every 73 days, medical knowledge doubles. That is a mind-boggling fact. More so when you realize that individual physicians and nurses are expected to keep up with all this new information. Is it even possible to do so? Can we reasonably expect humans to be able to learn, store, and implement all this new knowledge, or even just that knowledge that pertains to their immediate field of expertise? If burnout numbers are any indication, we've pushed human clinicians to their breaking point with new information and burdensome workflows. It's time to let humans do what they do best, and let computers play their best role, which is storing and crunching massive data sets. LLMs can alleviate physician knowledge gaps and offer decision augmentation by leveraging their vast contextual knowledge base and language understanding capabilities. For example, LLMs can help with diagnostic assistance. By grabbing huge amounts of patient data as input, LLMs augment doctors in diagnosing complex cases. The models can analyze symptoms, medical history, and test results almost instantly, and provide suggestions on potential future diagnoses based on patterns and correlations found in their extensive training data. It can be difficult for humans to have this level of insight into a single patient's health state. One patient's health record could be hundreds of pages long, but luckily, LLMs can help distill all that background into actionable information and ensure nothing relevant gets overlooked. Treatment recommendations. LLMs can offer evidence-based treatment recommendations to doctors. By analyzing medical literature and clinical guidelines, the models can be conditioned to provide insight into what treatment options might be effective for individual patients, appropriate dosage guidelines, and potential drug interactions for specific conditions. Again, AI can personalize these recommendations by contextualizing them to a patient's unique health state. No two patients are the same, and their care shouldn't be either. Since LLMs can be fed many millions of similar treatment pathways, it's almost like the model says, "Aha, I've seen this movie before. Here's how we can optimize a patient's outcomes based on scenarios I've encountered in the past." Risk assessment. LLMs can help in assessing and managing patient risk. In other words, how sick patients are or are likely to become. By analyzing all of that historical patient data, the models can predict the likelihood of future disease onset or progression, identify potential complications, or estimate the success rate of specific interventions based on patterns gleaned from thousands of similar patients. This enables doctors to make more informed and on-time decisions about patient care. Clinical guidelines. LLMs assist doctors in adhering to established clinical guidelines, or evidence-based medicine, by integrating these guidelines into their training set, called in-context training. The models can offer recommendations and suggestions to doctors, ensuring that they consider best practices and follow standardized protocols as they design treatment plans for patients. Rare conditions and complications. LLMs excel at considering rare conditions or potential complications that might be overlooked in everyday care. Not every doctor has seen every edge case, so having the augmentation of an AI system can mean the difference between early or on-time diagnosis, or not. By processing vast amounts of medical literature and linking that to patient records, the models can develop insights into unusual presentations of less common diseases, expanding the diagnostic possibilities for all doctors, everywhere. It's like having a world-class consultation in your pocket. Large language models augment clinical expertise by providing us with a broader perspective about specific individuals, as well as access to the latest medical knowledge. They can also offer a second opinion, assisting us in considering alternative diagnoses and treatments that we might not have initially considered. LLMs reason through, then generate predictions, recommendations, and alternative what-if scenarios based on their automated analysis of clinical data. Sometimes it can be helpful for human providers to interact with the models, asking them questions and receiving evidence-based suggestions to help them hone their own decision-making process and remove any built-in bias. This is called human-in-the-loop training, and it represents a milestone in the development of better, more human-centric AI models. Integrating high-quality, patient-centric LLMs into clinical workflows has the potential to improve diagnostic accuracy, reduce medical errors, and enhance patient outcomes. Some studies indicate that nearly 250,000 people die every year due to medical errors alone. By leveraging the model's vast analytical prowess, doctors can reduce the possibility of error creeping into their decision-making process and provide better personalized care for each patient. The collaboration between doctors and advanced AI, like large language models, offers a powerful synergy, combining human expertise with the computational power and language understanding of the models. So, this might leave you wondering, does this mean that AI is going to take my job as a physician or replace my doctor as a patient? Not in a million years. AI has limitations. It cannot replace the unique qualities that doctors possess, such as empathy, emotional intelligence, and the ability to understand the nuanced humanistic elements of patient care. AI can augment human care providers by doing what it does best: millions of statistical computations per second to weigh every possible patient outcome. But it will never replace human care. In this era of advanced technology, the integration of AI into medicine is absolutely necessary to turbocharge patient care in ways we could have only dreamt of before. The best patient care will be a collaboration between human expertise and artificial intelligence. Together, the two types of intelligence, human and machine, will pave the way for a future of better healthcare. You're watching Tech Talk Healthcare, where healthcare talks tech. Don't forget to subscribe.